Good morning, everyone. Thank you so much for joining me this bright Wednesday morning. I am the CEO of Sierra by the Sea and Sunrise Ranch, which are both addiction treatment facilities in California and are part of the Sierra Group. I put this webinar together because when I first started in behavioral health over 20 years ago, I had no idea what I was getting into and certainly had no idea the potential impact that working with clients with addiction and trauma could have on me personally. So with that being said, I'd like to talk to you a little bit today about some of the warning signs of compassion fatigue and some of the ways that we can work on really addressing those quickly so that we can ensure our health and the health of the clinicians that we work with. So away we go. So in this training, we're going to look at some of the early signs of compassion fatigue. We're going to look at some of the things that we may have inside of ourselves individually that predispose us to compassion fatigue and some of those corresponding vulnerabilities. And we're going to explore some guidance that can help us actually to enhance our compassion satisfaction with the work that we do. So you may be wondering, what is compassion fatigue? In the mid-90s, which was about when I got into the behavioral health field, researchers started to look at how exposure to the things that clients were telling them impacted the professionals who were trying to help them. In the beginning, it was looked at as secondary traumatic stress because it seemed like there were a lot of symptoms that paralleled those of post-traumatic stress disorder. In 2002, Charles Figley, who is kind of like the father of compassion fatigue, came up with the term, and he actually defined it as the reduced capacity or interest in being empathic or bearing the suffering of clients. So one of the issues that kind of drives the clients that most of us see in our practices is childhood trauma. Substance use disorder is a manifestation often of childhood trauma, depression and anxiety, suicidality, re-victimization, low self-esteem, difficulties with interpersonal relationships, impulsive behavior, and sometimes even violence. Vicarious traumatization is something that we can experience when we're hearing these stories of others and we are connected to them. That connection, because it is such an intense experience between the therapist and the client, really creates this almost psychic transmission of energy. So what we realize quickly is that the very act of being compassionate and empathetic extracts a cost. I remember the very first time I came out of doing a women's therapy group in a residential substance use treatment center in New York many years ago, and I walked in thinking, oh, I had all these skills and I was going to do this really great group and it was, going to be this amazing experience for me and the clients. And I walked out feeling like I had been run over by a truck. It was like every issue that was being brought up hit me personally. And I realized, wow, I have a lot of work to do to really be able to do this effectively. And it's not just about training, it's about personal work. We really need to attend to our compassion so we can stay healthy in order to really offer that optimum level of care to clients and also to preserve ourselves in the process. Some of the effects of secondary traumatic stress you will recognize as I said, symptoms of PTSD. So they're distressing emotions, intrusive images, numbing, avoidance, somatic ailments, that stomach ache that you get when you have that client who's coming in who keeps telling you about that terrible childhood abuse, addictive and compulsive behaviors, physiological arousal, interference in activities of daily life, and impairment in role functioning are all effects of secondary traumatic stress. Compassion fatigue is intrusive. It kind of seeps into our beings, and we don't even realize sometimes that it's happening until all of a sudden we're feeling so depleted that we're not sure what to do about it, and we're not sure where it came from. It really can impact us physically, emotionally, and spiritually, to the point where, sometimes we just don't even know what to do about it, and we feel like we can't do anything about it. It's burnout is a common phrase people use. Oh, I'm burnt out. This is such a difficult field to work in. It's so hard to hear these stories. Our dreams might even be invaded by those that the client shares, and the client's thoughts and images can intrude on our thoughts. I remember in the beginning of my career, I was a young mother. I had a baby at home, and I had a client who had, unfortunately, through her alcohol use, inadvertently killed her baby. And when she would tell me the stories about how this happened and how she woke up and was so shocked and mortified over what had occurred, I literally started dreaming that this happened to me. So it's a scary thing when it happens, and it really is very, very intrusive. Other symptoms of compassion fatigue can be distress, physiological reactivity, avoidance symptoms, losing interest in what we're typically interested in, feeling hyperarousal, that sort of jump reflex when something, surprises us, losing interest in connecting with others, kind of feeling like, oh, I don't really have what it takes to listen to this client today, or it starts to feel like you're hearing the same story every day. Not feeling motivated, not feeling effective, not really feeling like you're helping anybody, and really just feeling like you just don't connect. You don't feel that empathy that you once felt. Working with certain types of clients, researchers have found, really puts therapists at the highest risk. And those are people that have survived abuse, people that have survived trauma, and also individuals with personality disorder. I sort of got interested in the topic of compassion fatigue because I was doing a lot of research on working with individuals with borderline personality disorder. And I was really curious about that disorder itself. And I was really curious about my reactions to working with clients who had borderline personality disorder, as well as those of the people that I was supervising at the time. So as I was doing this research, I found out about this compassion fatigue thing that people often suffered from when they were working with these really challenging clients who were presenting with these behaviors and emotions and thoughts that were kind of all over the map. And it all kind of fell into place. And I thought, wow, we really need to do a better job for ourselves and the therapists that we supervise, in terms of helping them to take care of themselves, to not have these types of experiences and to get burnt out in their field. So there are some things that actually we individually bring to the table that can raise our risk and make us more vulnerable to the suffering of others. So if we have a history of abuse and or trauma in our own background, sometimes we can get very overly empathetic because we're actually identifying with that client and seeing in them what we see in ourselves. Obviously, this can really create issues with boundaries, with increasing our distress and really causing us pain. Another risk factor is when we're therapeutically overzealous, believing that, we can help somebody no matter what happens, and not looking at the situation realistically, in that, the client has to have a certain amount of autonomy in that decision making in terms of getting well. I remember reading about the savior complex and putting it together in terms of a coworker that I had who really, he worked 14 hours a day at the residential facility. He was always sick, but he was always trying to save somebody. He ended up getting very sick himself as a result. Having a lot of need for control also can cause stress and result in intolerance, because we want the client to succeed, we want them to latch on to therapy, we want them to get better and recover, and we think that they need to do it by a certain blueprint, and when they don't, we can get stressed out and and eventually just kind of say, well, there's nothing I can do for this person. This person doesn't want to do, what they need to do in order to get better. The main issue with our vulnerability is not really our not really just the exposure to the client's trauma, but how we react when we're working through and processing issues with the client. Sometimes a client's issues can be so powerful or so troubling to us that we want to stay away from them, and the client wants to stay away from them. So we sort of both form this mutual agreement of not, kind of not talking about those things or not processing those things. And the more that we cooperatively avoid those issues, the more our fear and anxiety increase, and our susceptibility to that vicarious traumatization and the compassion fatigue. If we lack personal survival strategies that, create resilience in us, we can really adapt sort of the same stress reactions when dealing with someone else's pain. When we lose our ability to access positive coping mechanisms, when we kind of lose touch of what resonates within us in terms of our own healing and our own life journey, and we become very obsessed with just, working with clients, trying to help them, and when we feel stressed out, instead of kind of going to those happy places, we go to the more dysfunctional coping mechanisms: overeating, undereating, drinking, isolating ourselves from family. We may even dissociate. We might distance ourselves or wonder if what the client is telling us is really accurate. We can be physically impacted. So many times, therapists develop somatic issues, especially gastrointestinal issues, as a result of the work that they're doing. And sometimes we just feel really sad because the things that have happened to the people that we work with are really sad, and we have to work on that healthy grief process in order to process that for ourselves and not get totally attached to it and brought down by it. Dissociation and feeling helpless are really some of the most classic symptoms of compassion fatigue. So when you hear a fellow therapist or, a trainee who you're supervising talk about feeling like, they're not making any headway, they're not making any progress, they feel really discouraged, that's a time really to start raising your antenna over the possibility that they may be developing compassion fatigue. Some of the more detailed warning signs, and I'm sure that many of us can relate to these at one time or another in our career, like I said, using food, alcohol, drugs, developing anger and resentment, having weight fluctuations, high blood pressure, getting irritable, feeling like you don't have any emotions, experiencing sleep disturbances, feeling depressed or anxious, feeling exhausted. I know that for me is one of the primary warning signs that I'm starting to move into compassion fatigue mode. Isolation, you don't feel like talking to anybody, you don't feel like connecting to anybody. Workaholism, like the guy I was talking about who was, 14 hours a day in the residential facility trying to save every single client. And then just disruption in relationships. So the good side is there are lots of coping skills and lots of prevention strategies that we can engage in that will help us move away from compassion fatigue and hopefully even nip it in the bud when we start seeing those warning signs in ourselves or those that we work with. We all have personality characteristics that we can draw on that will help us to effectively deal with this stress. One of the number one things that we have within us in order to effectively manage this stress is our perception. So looking at things in a way in which we are dealing with solvable problems and not these hopeless morasses of pain. So looking at how to break things down in a way that feels manageable and how to take care of ourselves in the process. Some of the qualities that offer protective value are a healthy character structure. So when you're able to manage anxiety in a healthy way and you can keep your own thoughts clear rather than getting sucked into the psyche of the client, that goes a long way towards preserving yourself in the therapeutic relationship. Having a well-developed sense of empathy and not a sense of empathy that just derives from having had the same experience as the client. Having a strong sense of self and having ability to respond to and enrich compassion. Sense of coherence is the most powerful defense against unhealthy psychological alterations and compassion fatigue. So that's really where we exist in this feeling of confidence that everything that comes at us is understandable, able to be managed, and meaningful. This is a particularly challenging quality right now when we're dealing with a global pandemic that seems to make no sense, right? So I think lots of us right now are grappling with, like, how do we put this terrible thing that's happening in the world um, into perspective so that it makes sense? We have to feel like things are manageable. So knowing that vaccines are on the horizon make us feel better about that. And I think the meaningful part of that is where people are doing some serious soul searching about the positive things that have come out of having to quarantine and having to spend so much time in our family environments and sort of reassessing our priorities. So I think having that sense of coherence is being able to take these, you know, really unfathomable situations and sort of make some sense out of them and look at how they can actually contribute to our potential growth and well-being. Having a sense of balanced empathy or detached concern. So that's where, you leave your office and you leave your clients behind. You don't bring your clients home with you mentally, emotionally, spiritually, while you're having dinner with your family. You're concerned about them, you care about them, but you're not so invested that the quality of your life is being impacted by the lack of quality in theirs. Really having that physical and psychological distancing, which is so challenging for so many of us these days with technology, right? Because we've got our cell phones, we can get our emails, we can find out what's happening at any minute with, anybody that we're working with. So really cultivating that healthy separation from clients and the work. Perspective, detachment, and confidence. Just, again, those things that contribute to that sense of coherence. Maintaining empathy and separating yourself emotionally while also bringing to the surface what's kicking your butt in those therapy sessions, through your own countertransference issues are really essential skills to cultivate if you're doing therapy. And it's really important for clinical supervisors to be able to help guide therapists through that process so that they stay healthy. Because lots of times we don't want to talk about the fact that the client that we're meeting with who's talking about their childhood sexual abuse is really, really, kicking something in ourselves. It's our responsibility as supervisors to really make that safe space for therapists to talk about those things and to normalize it. It's normal for us to be emotionally impacted by what our clients are sharing. It would be more abnormal not to be emotionally impacted by it, and it wouldn't really be congruent with what brought us into the helping professions to begin with. So one of the things that's really essential is creating and maintaining a personal care plan. The key is to base it on realistic expectations. So I am one of those people that, I will tell myself, okay, tomorrow I'm going to wake up, I'm going to meditate, I'm going to get on the treadmill, I'm going to eat the healthy breakfast. I'll have 10 things planned before 5 o'clock in the morning, which is not really realistic. It all sounds great and it would all be super helpful in keeping me, on track and feeling good, but it's just not realistic. So looking at the things that we can plan into our day that are going to sustain and nurture us, but not putting ourselves under pressure to complete this other, task that's insurmountable, that's going to make us feel helpless and just contribute to, further fatigue. So some of the basics of personal care is really, steering clear of that savior syndrome, respecting your personal boundaries. There are times when we have to say no. There are times when we have to put limits on the, conversations that we have with coworkers. Sometimes people want to complain about their work, or they're complaining about this, and you're already spent. You've already, listened to somebody's pain. You've listened to somebody's, complaints, and you need to just create that space for yourself. Cultivating an attitude of optimistic perseverance. We get through everything, and what doesn't kill us makes us strong. I mean, it's kind of a horrifying quote, but in reality it's true, right? We do grow from the experiences that we have, and looking always for that, that growth opportunity in the thing that has happened, or the conversation that we've had, and hanging in there, and knowing that sometimes in therapy it's going to be really, really challenging, and then all of a sudden there can be that breakthrough, that light bulb goes off, and all of a sudden things start to fall into place, and the client is feeling better and you're feeling better. Keeping your sense of humor. Sense of humor is so important when you're doing therapeutic work. Tuning into your self-awareness. What's going on in your body? What's going on in your mind? What's going on when you're sleeping? And really using others as a sounding board. Peer clinical supervision is amazing, really helps people to understand that we're all in this together. We're all experiencing the same emotions in relation to the stories that clients tell us. And it really helps us to feel less isolated, like we're not in silos. So good supervision can really help us to process some of this sharing and prevent some of the overwhelming thoughts or feelings that could come up if we're trying to work through these issues by ourselves. It can really help us to discover more compassion, not only for our clients, but also for ourselves, which is really key to good self-healing. So we want to spend quality time with others. We want to get out in nature. We want to get some movement going. We want to try to eat as healthy as we can. Definitely relaxation skills and stress management techniques, and that's whatever works for you. That solo time, doing whatever it is that helps you connect to a power greater than yourself. We really need to schedule our self-care, even if it's a few minutes a day, just so that we can recharge and reflect. So self-care is, just simply put, doing the things we need to do to maintain our happiness, our health, and the ongoing development of our minds in whatever way works for us. Self-care can involve, numerous activities: curiosity and exploration, slowing down, spending time in community, cultivating awareness, kindness, acceptance. So I hope that this has been helpful to you, and I hope that there have been some things that you'll be able to take away from this. And now I'm happy to answer some questions. Let's see what we have. Okay. Okay, can you elaborate on cooperative avoidance and how to realize you are a participant? Sure. So cooperative avoidance happens when we're working with a client who is bringing something to the table that for us maybe is a trigger point, or is something that we find really disturbing. I remember the first time that I worked with a client who actually had been a perpetrator of child sexual abuse. And so going into the sessions with that person, I really didn't want to talk about that. I found it, it was a horrifying topic. It was something that just, really disturbed me. And so we would talk around it. We would talk about substance use. We would talk about, different family issues, but we wouldn't talk about the subject that was on the table. And as a result, I would feel so stressed out and so anxious and fearful. And the client felt that as well. In giving that person permission to talk about what he had done, it also gave me permission to look at things from a different perspective. Not that there was anything at all acceptable about what he had done, but in order to try to process it and make sense of it. I think we can realize that we are participating in it when you know the client has this issue and it's not getting talked about, and you have pauses in the conversation where it would make sense for you to introduce it or to prompt them, but you hold back. I hope that's helpful. Let's see. Any specific examples of go-to easy things to implement when you first start to notice compassion fatigue? Yes, absolutely. So when you first notice that it's starting to hit you, it's really important to evaluate what you've got going on in your life. And is there an opportunity for you to take a break? Is there an opportunity for you to take a mental health day? Is there an opportunity for you to meet with your supervisor or mentor or somebody that you trust where you can talk about what's going on that's making you feel concerned? So, I'm feeling really exhausted. I'm not sure why I'm feeling really exhausted, and I feel like I don't want to, meet with this one particular client, or I don't want to meet with any of them. So I think trying to, really trying to find somebody to talk to about it in the beginning is excellent. As a supervisor, how do you bring this to a team is another question. So one of the things that I've done with teams in order to bring up the topic of compassion fatigue is I've actually brought in this assessment tool, which is called the ProQual. You may have heard of it. It's the Professional Quality of Life Assessment. And I've had everybody kind of fill it out and do this little, questionnaire to see where they are in terms of quality of life and feeling effective and feeling satisfied with their jobs. And it's a great way to kind of break the ice, because everybody will look at it and be like, oh my goodness, I can't believe, we're all kind of experiencing the same thing, and we're all feeling similar feelings in doing this work that we do. And it also helps to create a roadmap for addressing the various issues that come up in the assessment. Somebody asked what helped stop the negative dream. The negative dream went on for the majority of the time that I worked with that client. I literally would have the dream of her baby's death. Finally, at the end of treatment, when she had really done a 180 and coming in devastated, suicidal, she wanted, she wanted anything to separate her from this incident. I think in seeing her process it and in me processing it in my own therapy, because I was telling my own therapist that, I was having this dream and I couldn't understand it, we could really sort of unravel that sort of over empathy that I was having, because I had a baby at the time and it was just really triggering me. So I think the combination of being able to talk about it with somebody that I trusted, and also seeing the client able to not achieve total resolution with it, but able to do some processing with it so that she could move forward in her life in the best way that she could. I know we're about to go over time, so your questions are great though. Thank you.